The Theology, Medicine, and Culture Initiative has been hosting a series of conversations about COVID-19 with faculty and alumni. In this clip, TMC Director and psychiatrist Dr. Warren Kinghorn talks with TMC alumni Dr. Jennifer Lawson and Tara Corbett about the effects of COVID-19 on families and children.
So Warren, thank you for that really kind and generous introduction. I'm a general pediatrician at Duke Children's Primary Care, and just as far as context for experience, mostly I work in our acute care clinic with our learners, primarily with our residents, and if we have PA or medical students come through. So some of the direct experiences are, some are direct and some are more hearsay as far as that. What I've noticed, one of the things I've thought about a lot is just connection in all of this, how we're all interconnected. And so, and we've talked a lot about uncertainty in many areas during this period. And I feel like that's really palpable in the clinic setting. The COVID protocol changes from morning to afternoon to evening. It's much more stable now, but at the beginning, there was a lot of that dynamic, which just, I think, impacted everyone because no one really knew okay, we get this question, okay, who do we ask? What do we do? And I think in particular for the nurses who are a little more on the front line, they really felt that, or if there's one nurse in particular I think of, but it's not only her, who has a family member who's immunocompromised. So every time there's a question of whether the patient actually comes into the clinic, you just feel her anxiety and the repercussions of that. And then that carries into our patients as well and the families, because as a pediatrician, the children are dependent, right? And we're always worried about our children just because we love them and we care for them and they're family members. And then you add this on top of that and it raises that level. And then you add some of the communication gaps where we have 3 clinic sites. So sometimes we were sort of the sick clinic site, the respiratory site, and we have a Briar Creek site, and that wasn't even open because that was sort of the adult respiratory site. And then we had just sort of the newborns and the under 15 months at another site. And then some of the messaging, even between clinicians from the different sites, wasn't always clear. So that also, you could feel the impact on the parents.
Before I even get into my role and my agency, I'll just give the little spiel that I always give before I talk about these issues, because intimate partner violence, sexual violence, they're really heavy and they can be triggering for a lot of folks. So if that's something that you have ever been impacted by, feel free to take a minute, turn off your video, take a walk around the room, or the meeting altogether, and seek support, because these are hard topics. So yeah, like Warren said, I work at Interact. It's a dual agency, meaning we address both sexual violence as well as intimate partner violence. And so I coordinate the direct service volunteers. So that includes folks on the crisis line, folks responding in our local hospitals. If someone needs a rape kit, it's folks going into the courthouse if is filing a protective order and has a hearing, and it includes folks who facilitate the children's groups, which are basically like support groups for kiddos. So I supervise those volunteers, and I also supervise all of our interns that are usually social work interns or something similar to that discipline. In terms of how the pandemic is affecting those populations, it definitely has caused IPV violence to spike, and we've seen that on the front lines. We're seeing calls through our crisis line overall sort of ebb and flow, but we do have these really big waves where we're getting a lot of calls. We're getting a lot of really high risk calls, so partners who have been severely harmed and are in the hospital, having folks from the hospital or from law enforcement call us and say, you know, hey, this person has been stabbed or shot by their partner. So we're seeing a lot of things escalate pretty quickly. We're seeing sexual violence being traded pretty extensively. So we have more patients coming into the Solace Center, which, like I said, is our community-based forensic exam center. We're having more folks coming in right now than we did this time last year. It's just that who is perpetrating those assaults or those acts of sexual violence is just someone that the victim knows more closely. So it's not like a drug facilitated rape at a bar, it's a neighbor, or it's someone that they thought was a friend coming over. So we also saw a spike in protective orders being filed like right before the pandemic started getting out of hand. And so is that people were starting to sense that this was going to get bad and they were going to have to hunker down. And so they tried to get out while they still could. Since then, things have gotten more quiet on the legal side of things. And our theory, at least, is that, you know, it's a crisis. People are trying to just get through it and hunker down and try and make it work. And so when you think about domestic violence, sexual violence, it is ultimately about power and control. And so when you think about that, it makes sense to why we're seeing these spikes, because when people lose their job, when they're facing economic insecurity, if they're facing some concerns about their health, if they're feeling out of control, kind of like what you were saying, Jen, where just every day is different, everything is constantly changing, then it's more likely that someone who is already abusive and has abusive tendencies is going to want to assert that control over their partner. So we're seeing that a lot, and we're seeing the mental toll that it's taking also on staff as well. So it's been heavy serve as well as staff.
Thanks to both of you. That's really helpful context. This gets into your response, Tara, in some ways covers some of my second question to you, but I guess I would ask both of you, beyond acute illness, what are you hearing in your work about how families and households are challenged by the social changes and disruptions of the pandemic? Are there particular ways, are there particular kinds of themes that you're hearing from people that you're engaging with?
I think, there's some positive and some negative, right? So the gift of being able to spend a little more time together can be a positive, and have some of that be intentional. So one of my colleagues was saying the other day about, they get through the workday, but then after dinner, there's just this choice of family time and activities. And there are when Tara was speaking, I was thinking about a couple of the residents recently were saying that they're seeing a lot more trauma in ED. One said that there were 4 cases of non-accidental trauma all at the same time, which is very unusual. So I think that those are sort of similar ramifications where some people don't have the circumstances that to sit on the porch and listen to the rain and have some space and to go out for lovely hikes, but they're in a much more restricted setting with all these stressors and maybe underlying family issues. I feel like we've probably heard this in many spaces, is that this situation has been amplifying some of the issues that are already there, right? Whether it's poverty, mental health issues.
There are unique ways that abusive partners are kind of manipulating or using this pandemic in harmful ways, keeping the victim from seeking medical attention if they're exhibiting symptoms. And I would also add that there are just increasingly limited resources in the community, at least in Wake County. So I know a lot of the calls that we're getting on the crisis line, they're just a lot more complex. Normally when we would get a call, most of the time we would have someone come in for walk-in services and meet with a counselor and really kind of sit down, have that in-person contact, have that heightened empathy and compassion. Whereas now folks are over the phone and trying to safety plan, trying to find shelter when a lot of shelters are closed right now. And there's, before there's already nowhere to go, and there's a housing shortage or a housing crisis in Wake County, and that is especially the case now. So folks that were already vulnerable, it's heightened right now for a lot of reasons.